Hello, everyone, and welcome to today's webinar titled How Can Population, Health, and Environment Projects Learn from Family Planning High-Impact Practices? This webinar is hosted by the PACE Project and by the IBP Initiative. The PACE Project stands for Policy, Advocacy, and Communications Enhanced for Population and Reproductive Health. PACE works to assure family planning, reproductive health, and population issues are included in policies and programs as keys to sustainable and equitable economic growth and development. One focus of the PACE project is to increase commitment for multi-sectoral approaches to integrate population, health, environment, resilience, food security, livelihoods, and security programs. Hence our work on the family planning high-impact practices and PHE, and our interest in hosting this webinar. IBP is a unique global partnership of more than 70 organizations dedicated to scaling up what works in family planning and reproductive health. IBP supports the dissemination and implementation of the high-impact practices and leads the High-Impact Practices webinar series, bringing together experts to share implementation experiences with the global community. My name is Laura Cooper Hall. I am a policy analyst in the People Health Planet team at the Population Reference Bureau, or PRB. I will be moderating and presenting work today that was done under the PACE project. Next slide, please. Thank you. So during this webinar, you will learn about the Family Planning High-Impact Practices, Population Health and the Environment, or PHE, which is an acronym you will hear often, and a PHE project taking place in Madagascar called Mahefa Miaraka, and how it implements elements of certain high-impact practices, or HIPs. After the presentations, you will also learn about how the HIPs can be used to strengthen PHE projects through a question and answer session between two of our speakers. By the end of this webinar, we hope that you will have a better understanding of the HIPs, a better understanding of the link between the HIPs and the PHE approach, and you will have learned of HIP implementation successes and challenges in PHE programs at the country level. Next slide, please. So before we begin, a few things to let you all know about. First, the webinar will be recorded and will be posted online at the end of the webinar later today. Also, please submit your questions as they come to you at any time. We'll do a question and answer session after the presentations, after the Q&A session between two of our speakers. Also, please feel free to visit one of our websites at fphighimpactpractices.org, or the FP HIPS website. Next. Again, my name is Laura Cooper Hall. I'm on the left. And today I will be presenting alongside my colleagues Yvette Ribeira from JSI and Caitlin Newman from USAID. Yvette is the Chief of Party for USAID-funded Community Capacity for Health program. She has nearly 3 decades of public health service delivery and program management experience. Yvette brings with her exceptional experience in both public and private settings as a renowned researcher on issues related to family planning, maternal, newborn, and child health, and nutrition, and as a respected leader of public health projects, including the Population Health and Environment, or PHE, approach in Madagascar. Caitlin is a technical advisor in the Research, Technology, and Utilization Division of the Office of Population and Reproductive Health at USAID. Caitlin leads efforts on production and dissemination of the HIPs in family planning, supports the management of the Passages Project, and backstops the family planning staff in Mozambique and Tanzania. Once we each have presented, I will then moderate a discussion between Yvette and Caitlin, after which we will receive questions from the audience. So, to start us off, Caitlin will share some valuable knowledge and background on the FP family planning high-impact practices.
Thanks, Laura, and hello, everyone. Today, I'll provide a brief introduction to the HIPs and how they might help you in your work. Next. To begin, HIPs address 3 major challenges. First, there are many ways to increase knowledge and use of contraception, and decision makers don't have the time to review decades of learning in order to know what works in family planning. Second, one of the most common reasons programs fail is vague, ill-defined priorities. Finally, evidence used for advocacy is often viewed as biased and unbalanced. Let's turn now to the definition of a HIP to explore how HIPs address these challenges. Next. HIPs are a set of evidence-based family planning practices vetted by experts against specific criteria and documented in an easy-to-use format. We'll take a closer look at each part of this definition. Next. To begin, HIPs are evidence-based. When first exploring whether a practice is high impact, authors conduct a literature search for published data, and they use their networks to discover unpublished program evidence. Evidence from around the world is considered. Preference is given to evidence generated with the strongest research designs. The evidence base for what works in family planning is always growing and changing. The HIPs reflect our current understanding and represent an evolving process. Next. Here are the current high-impact practice briefs. As I mentioned, this collection is constantly changing as HIPs are added and updated. The HIPs are categorized as service delivery, enabling environment, and social and behavior change. You'll notice that there are different shades of blue under service delivery and shades of green under social and behavior change. These color variations show the strength of the evidence base for each practice. The darker the color on the HIP brief, the stronger the evidence base for the practice. Now you might be wondering about HIP enhancements at the bottom right. Enhancements are technologies or practices that are typically implemented along with a HIP to further intensify the impact. For example, adolescent-friendly contraceptive services can be implemented with any of the service delivery HIPs. Next. Now we'd like to hear directly from you with a live poll. From the list of HIPs provided, you're going to select those of most interest to you. So go ahead and click the HIP that is of most interest to you and select all that apply. All right, we're getting some inputs. I'll give you a few more seconds. Great, let's look at the results. All right, so it looks like there is a lot of interest in community health workers and community group engagement and interest in each one of these high impact practices. I encourage you to review the HIP list, which is in the handout section of the webinar. This 2-page document lists all of the HIPs with links to the briefs on the website. Let's go forward. All right, let's dive into the second part of the HIP definition. Members of the Technical Advisory Group, or TAG for short, are international experts in family planning research, programming, and implementation. They hail from donor agencies, research institutions, and implementing organizations. TAG members review concept notes for new briefs, and they review final briefs to ensure the practice meets HIP criteria. Included in this decision-making group are representatives from the HIP core conveners. The core conveners set the agendas of TAG and endorsing organization meetings. They select new members for the HIP TAG, and they support promotion and outreach of the HIPs. Next. HIPs are based on specific criteria. To be considered a HIP, A practice must demonstrate impact on contraceptive use and be feasible and relevant in a variety of country settings. Consideration is also given to other family planning related outcomes, scalability, sustainability, and cost. Next. Now for the third part of that definition. HIPs are documented in an easy-to-use format. Evidence is distilled into HIP briefs, which are kept to 8 pages for easy use. Each brief clearly defines the practice, identifies challenges each practice can address, summarizes the evidence of impact, and offers implementation tips. Briefs are available in English, French, Spanish, and Portuguese. Next. Now, how might you use these briefs in your work? We have found that these briefs are useful for advocacy, for strategic planning, for program management, exploration of research gaps, and to inform policies and guidelines. While HIPs are not intended to include the level of detail necessary for program implementation, all briefs do include a section of implementation tips. These tips focus in part on common implementation pitfalls, gender considerations, adaptations for subpopulations, and sustainability. How HIPs are implemented matters. High impact practices need to be adapted to the context of the communities they serve, and not every country or program needs to invest in every HIP. Next. Okay, we're going to hear from you again. Please tell us how you might use the HIPs in your work. Select all that apply. Okay, we're getting some inputs. I'll give you a few more seconds. Okay, let's see the results. Okay, it seems like most of you could use these HIPs for strategic planning and then for program management, to inform policies and guidelines. Great. Let's move on. In addition to briefs, the HIP Partnership has also developed strategic planning guides. These guides are intended to lead decision makers through a process to identify effective and efficient investments for the focus of their program. Guides help planners identify which practice might work in their specific context. Current examples include improving sexual and reproductive health of young people and engaging men and boys in family planning. Next. For any and all information about the HIPs, please visit fpHighImpactPractices.org. You can also find the HIPs on Twitter with the hashtag HIPsForFP. I'll wrap up this section with a shout out to the more than 30 organizations which endorse the HIPs. These partners play a vital role in developing, reviewing, disseminating, and implementing high-impact practices. Many of these organizations have also implemented and supported PHE programs, such as, of course, PRB, which is hosting this webinar, and JSI, which we will hear from soon. Laura, back to you.
Great, thank you, Caitlin. Now that you listeners have a clearer understanding of the HIPs, let's dive into PHE and how the approach links to the family planning high-impact practices, with a focus on how the HIPs can improve PHE program outcomes. Next. So, PHE programs use integrated approaches to improve access to health services, especially family planning and reproductive health, while helping communities manage natural resources and conserve biodiversity and the critical ecosystems on which they depend. At their most basic level, PHE programs typically address family planning and reproductive health needs, as well as other primary health needs, which enables communities to also prioritize conservation, natural resource management, and related issues like sustainable livelihoods and food security, which are often closely tied to natural resource management. PHE programs recognize the many ways that human health, population dynamics, and the environment interact. For example, rapid population growth can drive unsustainable environmental practices that may impact health and economic outcomes, and place pressure on social sector services such as education and healthcare. Changes in the environment, Changes in the environment can impact livelihoods, food security, and nutrition, especially where these are directly dependent on the environment. These factors affect people's health and overall security. Also, pressure on ecosystems can have unpredictable and potentially severe future effects on health and its social determinants and environmental determinants, such as clean air, safe drinking water, food security, and shelter. Next. So, why is PHE an excellent way to help remote communities develop? Here are a few reasons why. Integrated projects are cost-effective for organizations and time-efficient for communities. Integrated projects often lead to improved participation of men in reproductive health and family planning, and of women in natural resource management. Family planning and conservation are often better received when they are packaged with other benefits such as small income generation. Integrated projects can reach the most hard-to-reach populations, and they can be more responsive to the community's self-identified priority needs. Next. So, the PACE project published this brief titled Family Planning High Impact Practices Can Improve Outcomes for Population Health and Environment Programs, and of which you can see a snapshot here on the left, and you can also find in the handouts on this webinar. This was published in September last year, and the web feature on the right, you can see a snapshot, and the link to the web feature was completed in mid-December. These two tools show readers how PHE projects and the HIPs can both be used to strengthen the other, and highlight examples of PHE projects which do implement strategies that fit into certain high-impact practices, which have proven impact, while also showing how these projects can do more. Both resources share 3 key messages, followed by a few key recommendations for practitioners and policymakers. The 3 key messages are that PHE projects already do use elements of high-impact practices. PHE projects could strengthen impact by intentionally using high-impact practices, and also that PHE projects enhance the HIP evidence base itself. The recommendations focus on the message that PHE projects' intentional use of the HIPs can achieve greater impact and build the evidence base. Next slide. So, the first key message. Most PHE projects do carry out activities that align with elements of select high-impact practices, even if the activities are not identified as or deliberately tied to the HIPs. For example, many PHE projects implement activities that align with elements of HIPs in the enabling environment category through policy work with decision makers like ministers or county governors. For example, PHE projects with a focus on sustainability often support policy implementation through training and public sector assistance, activities included within the policy high-impact practice. You can see a few examples of PHE projects which implement elements of enabling environment high-impact practices in this table that is taken from the written brief. This table was generated from a survey that requested PHE projects to self-report the high-impact practices they implement. A much more expansive table with examples of other PHE projects with activities from other select HIPs can be found in the web feature. So I encourage you to visit the web feature to see more examples. Next. Okay, now let's go to you all, back to you all. We have another poll question, which asks, which HIP do you think was referenced most by PHE practitioners in the practitioner survey that was shared? So please select one. Which do you think was referenced the most by PHE projects? I see quite a few of you are voting in. Please choose one of the four. I think so. Most of you are correct. We actually had varying responses. PHE projects implement actually a few of these practices, but the practice that was most referred to was, I'll give you a few more seconds. So the correct answer is the community health worker brief. So 53% of those who voted in got that right. But the policy brief was also mentioned, and as I gave as an example in the earlier slide, that is a high impact practice that many PHE projects do implement elements of. Okay, next slide. So as you know, the HIP briefs help the family planning community achieve better outcomes by providing guidance on lessons learned and tips for whom to target and how. To strengthen the impact of their activities, PHE projects should strategically consider how to leverage the HIPs they currently implement and to explore opportunities to strengthen their projects by using additional high-impact practices. For example, the Community Health Worker HIP is a clear example of a potential entry point for projects hoping to strengthen their activities. You can see an image from the HIP's webpage for the Community Health Worker HIP on the slide. When supported by other HIPs and HIP enhancements, the potential effectiveness of community health workers increases. The Policy HIP, Social Marketing HIP, and Digital Health for Systems HIP enhancement are all HIPs that can be taken up by projects to support community health workers. For more details on this, feel free to check out the policy brief and web feature. PHE projects should also improve measuring and reporting on any and all use of HIPs that they implement. By doing so, they can contribute to the HIP's evidence base while simultaneously generating data on their own work. The HIPs briefs can be used as a resource on how to evaluate these activities. Next. PHE projects' use of HIPs present a unique learning opportunity for the family planning community because the projects serve remote communities where family planning services are often not accessible. Additional analysis, however, could identify which family planning program investments contribute to project results. This knowledge can then contribute to the HIP evidence base. While PHE projects may implement family planning activities that reflect elements of high-impact practices, they often do not document this contribution in their project reports. The PHE community is also always in need of data on project results, so evaluating the impact of these projects, including reproductive health activities, will help practitioners understand how their strategies impact communities. Intentionally using, measuring, and reporting on HIPs could also increase opportunities for PHE projects' family planning results to be recognized by the wider reproductive health community. Next. This brief and web feature that I've mentioned serve as a starting point for collaboration between the PHE and family planning communities. The goal of this work was to encourage conversations about how intentional use of the HIPs can help PHE projects achieve stronger family planning outcomes, and how increased knowledge of PHE project family planning work in rural areas can better inform the HIPs. several recommended actions can promote this collaboration. First, we need to strengthen the awareness of the HIPs among PHE implementers and advocates. Greater knowledge of the HIPs will help the PHE community strengthen its family planning activities and enable PHE implementers to identify additional ways to improve their family planning work. We must also advance the best practices of HIP implementation. One suggested way of doing so is for PHE projects with proven effective family planning practices to promote staff as HIP or PHE and PHE champions. And finally, we also need to do more to measure and report HIP results within PHE projects. PHE project staff could more effectively measure the impact of HIPs they use. Project managers should encourage and support PHE project teams to rigorously measure the impact of HIPs and conduct additional research necessary to identify causal links, benefiting both the family planning and PHE communities. The resulting outcomes would convey the importance of PHE projects' contributions to international family planning goals and strengthen the HIPS evidence base. Next. The web feature highlights 3 PHE projects showing how each one implements elements of high-impact practices while also providing guidance on how they can do more. These 3 projects are the Tungane project, implemented by the Nature Conservancy and Pathfinder in Tanzania, SAFEED, implemented by Blue Ventures in Madagascar, Hope LVB, implemented by Pathfinder and partners in the Lake Victoria Basin. We will also be hearing from Yvette about the Mahefa Miaraka project, implemented by JSI in Madagascar. She will go on to provide similar knowledge on how the project implements elements of the HIPs and other opportunities for using HIPs to strengthen investments. Please feel free to check out the web feature to learn more about these projects, how they implement certain HIPs, and what more they can do to strengthen project outcomes. The web feature includes videos for 2 of the projects with dynamic learning material. I'd like to thank Caitlin and Yvette for their help in creating the brief and the web feature, and to Ados May of the IVP Initiative for help with ensuring that this webinar and sharing of this knowledge takes place. Now I'll hand over the presentation to Yvette.
Yvette, go ahead, please.
Thank you. My presentation today will be focused on the GSI experiences in implementing evidence-based high-impact family planning practices in environmental settings in Madagascar, especially in the area of policy development, service delivery through community health volunteers, and information and education using mass media that fall under policy, community health workers, and mass media HIPs respectively. Next. My talk will be divided into 4 parts, with a brief background followed by a description of the program implementation, then a presentation of key findings. I will conclude with some recommendations to fully apply HIPs. Next. To start, Madagascar, the 4th largest island in the world and located in the Indian Ocean, is known for its unique biodiversity, that is, however, endangered by high population growth, poverty, and need for arable land. In addition, rural and remote people suffer from inequity and lack of information and services in family planning, results of limited coverage and access to health facilities. Next. Since 2011, GSI has been working to implement community-based programs founded by USAID. Next. In all villages of 34 districts out of 112 total of the country, of which 65% are coastal and or environmental areas. The Community Capacity for Health program, known locally as Mahefa Miaraka, aims to both strengthen public sector capacity to plan, deliver, and manage community health services and community engagement for health in accordance to the National Policy for Community Health. Next, the National Policy for Community Health guides GSI work, in setting up community health volunteer services in remote villages through integration of the CHVs in the health system and standardization of implementation across targeted areas, widespread role and responsibility of community actors to achieving primary care goals and health universal coverage, expanding coverage of children under 5 case management and FP services to the last miles. Next. In terms of service delivery, GSI works in partnership with NPCH committees and the MOH to identify, train, equip, and supervise CHVs in program-supported areas. CHVs are selected by their communities, supported by local coordination committee, and trained, certified, and supervised by Basic Health Center. In addition, the program supports the Ministry of Health to equip them in family planning counseling and service provision job aids and tools. Next. In addition, the program is dedicated to promote behavioral change communication activities in health, including family planning, through CHV's home visit, group sessions, and/or high visibility events to create demand for FP information, access, and use among community members. Next. As a result of the implementation of the program, policy document, norms and guidelines and curricula were updated and law developed and approved by the Parliament. Next. In the area of CHV's HIP, 90% of the total CHV trained, of which more than half are male, are providing short-term FP counseling and services to women in their respective village, increasing the geographical coverage in FP information and service from 15 to 72% between 2013 and 2018. Next. Since the CHVs started to provide FP services in the field, including in environmental areas, an annual average of 36% of the total new users in family planning were registered by CHVs. Next. In addition, from 2012 and 2016, the contraceptive prevalence rate in the program's 34 districts increased, with an annual average increase of 3.9% compared to a 2% increase for the whole country. The unmet need for FP also declined by almost half from 2014 to 2016. If the trend continues, contraceptive prevalence is expected to exceed the 2020 national target of 50% by 12 percentage points and would effectively contribute to the country's economic development. Next. Using the CYP ADINI-TAP calculation methodology, an annual average of about 35,000 unexpected pregnancies would be averted. Next. In addition, the country could save per year about $520,000 in vaccinating children. Next. In terms of social behavioral change communication under the mass media HIP, GSI has contracted with local radio stations to broadcast FP information and its benefits, reaching many in rural communities. CHV activities consistently represent another important channel of education for community members. Next. To conclude my talk, I would recommend 3 points in order to fully apply FP high-impact practices in the field and in the area of PHE. Next. 1. Disseminate the HIPs to help decision makers to develop a code such as a FP law or a health and environment policy to institutionalize the status of CHVs and to standardize FP goals and services in PHE areas, while engaging government to allocate appropriate budget to FP programs. 2. The task shifting for FP short-term service delivery to CHVs will ensure the achievement of universal health coverage and the FP 2020 commitment. 3, HIPS will help to have a standardized approach to integrate youth and men as priority targets for FP information access and personalized services, and will ensure effective equity to FP. And that ends my talk. Thank you for listening.
Great. Thank you so much, Yvette. It's really helpful to hear from your experience and to really ground what Caitlin and I have talked about in a country and project example. So that's very helpful. It would be great now to be able to go a little deeper into the links between family planning and high impact practices and PHE. So I have a few questions for Caitlin and Yvette. But before I go to those questions, to the listeners, if as we discuss, any questions come up for you, feel free to write those questions into the GoToWebinar software, into the little bank there. Please type those into the question pane, and we can see them, and we can respond to them. And we can respond to those later after this more formatted question and answer session of the presentation. All right, so next slide. So here are 3 questions we've put together, which I think can really help us go a little deeper into the links between the HIPS and PHE. I'll be asking these of Caitlin and Yvette. So let's start off with the first question. Yvette, how about I ask you first? Do you think that most PHE projects are using the HIPS brief to implement their project activities? If you think use isn't common, what barriers do you think prevent PHE practitioners from implementing them? Please go ahead, Yvette.
Yeah, I think based on what we have as response from the attendees today, I would say that not most of the PHE projects are using HIPS briefs in their projects because of, for example, in settings such as Madagascar, barriers to access HPs exist and may result from the lack of time or resources, and I think also the low access of to technology.
Yeah, I think that you make a great point, Yvette, that like many fields of work, practitioners are often very stressed for time and can be stressed for resources, particularly depending on their setting. And one big issue for PHE projects is that many of them, and not issue, it's a big it makes their work very valuable, but they are located in very rural areas, which was brought up in the brief and in the presentation, but really adds value to the outcomes of those projects, but does create a barrier in terms of accessing information. Yeah, Caitlin, do you want to respond?
Yeah, something that I would add to that is, we saw with Yvette's presentation that there are many PHE projects that are already implementing elements of HIPS. So a lot of people are already implementing these things, but they're just not identifying them as high impact practices. So I feel like, looking at the HIPS, looking at, what is already being implemented and how you could strengthen or sharpen that implementation is just the added value that the HIP briefs can bring to what's already currently happening.
Yeah, I think making that link more explicit is really the missing link, the missing piece for use of the brief. That's another great point to make, Caitlin.
Right, and we understand that a barrier to accessing the briefs is like a lack of technology, access to technology. So what we try to do from the global level is make sure that HIPS are represented in regional meetings and at country level meetings. So Yvette and anybody really on this webinar, if you know of upcoming meetings where a lot of PHE practitioners are coming together, feel free to reach out, and we would be happy to use that opportunity to further spread information about the high impact practices in family planning.
That's great. Yeah, it's great to make sure that these work, and it's the same for PHE projects as well, are present in shared spaces and key learning, sharing spaces. Yeah, so those are a great few barriers that definitely are very real ones for PHE projects and other projects that could benefit from using the brief to strengthen their activities. So that kind of leads well into the next question that I'd like to first ask of Caitlin. So clearly the family planning high impact practices can strengthen PHE projects. Do you think that PHE projects or learning generated from those projects and activities could be used actually to strengthen the high impact practices?
Absolutely. I think making this link stronger between the HIPS and PHE projects could be a real win-win for both. Because the evidence base for what works in family planning is always evolving, we look to implementers of PHE programs to monitor and evaluate their activities so that we can better understand the impact of those activities on contraceptive use and other family planning outcomes. And Laura, as you said earlier in the webinar, because PHE projects they serve remote communities, and that's a really unique aspect of these programs, I think it's a unique opportunity to build the evidence base. We don't have a great understanding of what works for these particular populations, and so PHE projects have a unique role to play in building the evidence base for what works in family planning.
Great, thank you, Caitlin. Yvette, do you have anything to add to Caitlin's point? I think that is Caitlin brings up a really important point of, as we mentioned already, that it's important for projects to monitor and evaluate and really document the effects of activities. Do you see more and more emphasis being placed on evaluating and identifying key results amongst the PHE community? Yvette?
I would add to the Kathleen remarks that in an implementation perspective, the use of HIPS are mainly based on the policy and guidelines in place and in force in the country. And while the impact of FP in the PHE projects depends also on the design and goals and approach of these PHE projects, and that may open to some updates of existing HIPS, also based on what is the evidence that may give as an added value to these PHE projects.
Mm-hmm. Yeah, I think there's a lot of information and resources about that and about the added value that you can find on the HIPS webpage and within the brief. Thank you both for responding to that question in such a helpful way. So our last kind of formatted discussion question focuses on the next steps. So what next steps do you both see for HIP implementation and project strengthening? And what do you suggest to PHE practitioners and decision makers? We've kind of started hinting at responses to this question, but I wonder, Yvette, what you think some next steps for including...
If I can...
Go ahead.
Go ahead.
Right, so what do you suggest, Yvette, for strengthening the work? Yvette?
Yeah, sorry. I think that I already mentioned in my conclusion some recommendations, but it depends also at what stage of advance of the project to advance each of the practitioners or decision makers are, so they can choose how they can really take the next step or move in first for making advocacy or using some hips for implementation or to adjust the strategic planning. So they can take all of these steps depending on where they are. And but in addition, I would suggest that also practitioners and decision makers may also share, learn, and use the existing HIPs first as appropriate. And they can also share the data reporting, making documentation of best practices, making some exchange via forum and PHE networks, so that just make everybody stronger, and we can just have a level of advancing to in the same way. And just being in the same level to have an harmonized approach and harmonized PHE and HIPS implementation around the world.
Yeah, I think you make a great point. Two great points. First, of making sure next steps are really targeted for the audience and for their context. I think that's always very important to remember in all the work that we do, but especially in for what next steps to take with the high impact practices. And also really encouraging this community of sharing, learning from each other, and like you said, sharing data and really focusing on best practices. I think the PHE community really benefits from being a pretty well-connected community, one that shares pretty regularly best practices or learning with each other. And it would be great if we could really capitalize on that and share more best practices with each other. Caitlin, do you have anything to add?
Well, those are great points, Yvette. The only thing I would add is I would encourage attendees today, either implementers or decision makers, to take a look at the HIP briefs that we have available on the website. Look at which ones you're currently implementing and how you might strengthen or sharpen the implementation of that high impact practice. And then also look at practices that you're not currently implementing or investing in, and think about how they might improve your program. Again, not every program or country needs to invest or implement every HIP. This isn't a competition. It's just a starting point to the conversation.
Yeah, I think that's a great reminder for us all that the HIP webpage is a great place to start. And especially just to clear up initial questions about how the HIP briefs are formatted and what value they can really provide, because there's so many sections within a brief that each have so much value in and of themselves. So that's a great reminder. Thank you, Caitlin. Great. Well, I'm glad we had this little formatted discussion that allowed us to get a little more depth out of the content we've presented. We've actually received quite a few questions from the audience, so we'll try to get to as many as we can in the next 10 or so minutes. I'd like to direct the first question to you, Caitlin, really focusing on clarifying a little bit more the high impact practices. The question is, are the enabling environment HIPs also color-coded by evidence strength? I think this really is part of a broader question of whether, and if you could answer or speak to this, how the HIPs are organized and determined based off of evidence. Is there a hierarchy of evidence strength? Could you give us a bit more information about how those are determined?
Yeah, sure. The short answer is that enabling environment HIPs are not differentiated according to the standard of evidence. The reason for that is because the evidence that we have on the enabling environment HIPs is not as directly linked to impact on contraceptive use, right? And you can understand this if you look at a few examples. So supply chain management, for instance, we know that that is critical and it is a high impact practice in family planning. It's more difficult to show the direct link from supply chain management to contraceptive use. So that's one reason why we don't differentiate the evidence base. But that's not to say that the evidence base isn't there, right? The enabling environment HIPs have gone through the same process of looking at the evidence and determining against that criteria that I talked about that these are high impact practices.
Great. Thank you, Caitlin, for providing a bit more background on how those are determined. I think that's really useful for those of us who are still feeling pretty new to the HIPs and the HIP briefs and the technical quality of each one of those. Another question we have is here for you, Yvette, if you could respond to. The question is, to me, it seems that the project, the Mahefa Miraka project, is very much focused on family planning. This listener would like to know if you could share a bit more about the environmental element or conservation element of Mahefa Miraka. Yvette, could you share some background on the project from the environmental or conservation side, please? Yvette? Yvette, are you there? We may have lost Yvette and her sound. Let's move on to the next question for now as we hope she connects. So this is another great question from one of our listeners. Thinking more about the side of PHE projects that include experience in low resource settings. Caitlin, do you know much more? Do you know of examples of projects that are very low resource, and whether those projects can have experience implementing high impact practices? Do you know, or would you have more recommendations for how low or projects in low resource settings could use the high impact practices?
So I don't have a particular program in mind, but I can think of an instance where a low resource setting project might, for instance, they might have community health volunteers that are unpaid, that are selected from the community. Now we know from evidence from across the world that community health workers are more effective when they are paid. But we understand that in a lot of contexts that might not be feasible or applicable. So I think it's okay, and this is why it's important that all HIPs are adapted to the context that they serve, right? So it's not like if you can't follow all of the implementation tips of a HIP that you can't do that practice. I think you need to look at each brief and think about how to adapt it for your specific program or setting.
Great, that's really helpful. I think that's very helpful for initial projects to hear. Yvette seems to have lost her connection for now, but hopefully she can try to reconnect. So another question of the many from our audience. This is a more open, general question about best practices for applying the HIPs. So our audience member is wondering if there are best practices about application. It sounds like there's great evidence being built surrounding the outcomes of applying the HIPs, but this listener is wondering about best practices in taking the HIPs from paper to practice, and to then effectively use them for advocacy and improved program design. In terms of best practices, from what I've seen on the HIPs briefs online, there are quite a few examples within each brief of how specific projects have implemented that high impact practice. And those can really be used as examples for learning from someone who's curious or a practitioner curious about HIP implementation.
Yeah.
What do you think, Caitlin?
Yeah, you can look at the impact section in the high impact practice brief and they reference the studies that have shown impact. So you can go and look at those studies to see examples of programs that have implemented this practice in a real world setting. So that's one way that you can think through how to apply HIPS in your work.
That's great. Yeah, thank you. I think that's a good starting point as well for listeners. Really, as someone who is fairly new, very new, a novice in the HIP expertise world, as we were putting together the brief, the policy brief published under PACE, the HIP webpage was incredibly deep and full of really helpful examples. And though I am not a PhD practitioner myself, I could really see how the brief could be used by practitioners and be made very helpful. We have another really great question from an audience member. This question is prefaced with, "It seems likely that family planning and health organizations are using the HIPS more often compared with conservation and environmental organizations implementing PHE projects. So this listener is wondering if we have any ideas for how we can do a better job of promoting the HIPS among our environmental or multi-sector partners." I think this is a great question and one the PHE community can often struggle with, just in terms of encouraging family planning projects and family planning project implementers to take up this more integrated PHE approach. But it's a question that's now focused more on a similar issue, but with using the HIPS amongst the environmental and multi-sector partners. Caitlin, do you have any ideas for that?
Yeah, Laura, I really appreciated your recommendation that you wrote into the policy brief, which is to identify champions within your programs that kind of wear the HIP hat. So this should be a person, or this could be a person that is constantly looking out for, are we monitoring and evaluating our programs so that we can build the evidence base? Are there areas where the HIPS could strengthen implementation and play that exchange of the win-win scenario that could be between PHE programs and the HIPS? I think identifying champions who, as part of their role in a PHE program, is to identify where these links can be strengthened. I think that would be one way to increase utilization of the HIPS.
Great, thank you. I hope that's, a good, helpful start for our listeners. Just because of the few minutes remaining, I'd like so Yvette, though she is not audibly connected, did have a response to the question directed at her. The environmental aspect of some basic environmental aspects of the Mehefa Miraka project are that they work on forest preservation actions and marine conservation in Madagascar, very much through a model of partnership and community environmental and health education. So there's a strong emphasis on educating communities about those links. But she also would like to mention that she is very much available for any follow-up questions after this webinar, and that is true of all of us speakers on this presentation. So I think we'll have to close the question and answer session out for now. But again, please do reach out to us with any questions. So before we completely close out, I have a few reminders. Thanks again to all of you who did submit questions and are listening in to the webinar today. So the recording will be shared. It will be shared tomorrow, and you can find it at this link that is posted here. The presentation will also be available in PDF form online alongside the recording once that's been completed and formatted or posted. So here are two links. And this will be shared out to all of you who've connected today. Next. I'd also like to mention that one of the activities the PACE project manages is the Global PED Network. This network is made up of hundreds of PHE practitioners. So if you're interested in PHE work, then you may be interested in joining the Global PED listserv. Feel free to write to the email address on this slide if so. You can see it under the first bullet point. So the network, just as a bit of background, used to be called Africa PHE. However, we've shifted the name of the group to Global PED because of the growing number of PHE projects happening around the world, not just in the Africa region. So please feel free to get in touch through that email address. So again, thank you all. As you log off, if you're interested and have the time, please feel free to hang around. We'll be actually showing a short little video on the hips. So for more information, again, though, here are our web pages. And again, there are handouts connected to the GoToWebinar software that you can download for more information from the brief and the family planning high impact practices. So thank you all, and we look forward to being in touch.
High-impact practices in family planning, also known as HIPs, are a set of evidence-based family planning practices vetted by experts against specific criteria and documented in an easy-to-use format. There are many ways to increase knowledge and use of contraception, and decision makers don't have the time to review decades of learning in order to identify what works in family planning. HIPs were created to address this need and develop consensus around high-impact practices in family planning. In fact, more than 30 organizations endorse the HIPs. To be considered a HIP, a practice must demonstrate impact on contraceptive use and be feasible and relevant in a variety of country settings. Consideration is also given to other family planning-related outcomes, scalability, sustainability, and cost. Here are a few examples of HIPs. An example of a service delivery HIP is to offer contraceptive counseling and services as part of facility-based childbirth care prior to discharge from the health facility. In Indonesia, the percentage of women leaving the facility with a modern contraceptive method after giving birth increased from 9% to 41% when women were offered contraceptive counseling and services. An example of an enabling environment HIP is to galvanize commitment to support family planning programs. In Guatemala, the national government allocates 15% of the alcohol tax revenue to reproductive health programming. Between 2006 and 2012, this tax contributed an estimated $24.3 million to reproductive health programming. An example of a social and behavior change HIP is to use mass media channels to support healthy reproductive behaviors. In Burkina Faso, women were twice as likely to use modern contraception when they could recall all components of the mass media campaign when compared to those who could not. Here are some other HIPs for which the evidence has been reviewed and briefs have been developed. Available in English, French, Portuguese, and Spanish. Our website, www.fphighimpactpractices.org, has resources on each of these HIPs and offers opportunities to learn, connect, and contribute. On the website, you will find our library of HIP briefs. Each brief defines the practice, identifies challenges each practice can address, summarizes the evidence of impact, and offers implementation tips. The briefs are useful for advocacy, strategic planning, program management, exploration of research gaps, and to inform policies and guidelines. You will also find strategic planning guides, which are intended to lead decision makers through a process to identify effective and efficient investments to address the focus of their program. Guides help planners identify which practice might work in their specific context. Examples include improving sexual and reproductive health of young people and engaging men and boys in family planning. HIPs reflect our current understanding of what works in family planning programs. How HIPs are implemented matters. HIPs need to be adapted to the context of the communities they serve, and not every country or program needs to invest in every HIP. The list represents a great starting point for anyone considering family planning program options. Come explore the website.